You know, when that chronic spinal pain starts to run your life, it's never just a simple ache, is it? It's the plans you have to cancel. It's the moments with your family you can't fully enjoy. It's just this constant drain on your energy and your happiness. But what if there was a way to actually target the root of the problem? A way to do it without surgery and genuinely get your life back? Well, stick with me, because that's exactly the path we're about to explore.
Okay, let's just get right to it. Does this image look maybe a little too familiar? That nagging, grinding pain in your neck that just won't quit? Or that deep, constant ache in your lower back that makes something as simple as standing up feel like a huge effort? And oh, that searing electric pain of sciatica, that lightning bolt down your leg. If you're nodding along, you're not alone. These are the exact spots where millions of people feel that daily battle.
But, just knowing where it hurts is only half the battle. It's not even close. To find a real solution, we have to dig deeper and figure out the why. So let's get past the symptoms for a minute and look at the actual structural problems that are causing all this pain.
Now this shows the usual suspects. First up, you've got disc issues. Think of the soft cushions between your vertebrae. When they bulge out or even burst, they press right onto your nerves. Ouch. Then there's something called spinal stenosis. This is when the tunnel your nerves travel through literally starts to get narrower, squeezing them. And finally, you have facet syndrome. That's just painful inflammation in the tiny joints connecting your spine. The main thing to get here is this: your pain isn't just some random feeling. It has a real physical cause we can point to.
Okay, this is where we need to have a serious chat for a moment. Because understanding the cause is one thing, but realizing what happens if you do nothing about it is a whole other level. Ignoring these issues doesn't just mean more pain. It actually starts a predictable and frankly dangerous domino effect.
And here is the absolute crucial point. This kind of problem, it does not fix itself. It doesn't stay the same. As this slide says, loud and clear, spinal degeneration is progressive. That means it actively gets worse over time. If you ignore that root mechanical problem, you're almost certainly on a path that leads down a 3-stage decline. And it all starts right here at stage 1, excruciating pain. This probably sounds really familiar to a lot of you. The physical breakdown is happening. A disc is bulging, putting a ton of pressure on a nerve root. That is where that sharp, stop-you-in-your-tracks pain is coming from. But if that pressure isn't relieved, the body gets forced into stage 2. And this is where things get really frightening. The nerve compression gets worse, and the signals themselves start to, they change. It's not just about pain anymore. Now you're feeling tingling, maybe some numbness, or even a real noticeable weakness in your arms or legs. That's your body screaming a warning sign that the nerve is in serious trouble. And that warning leads directly here to the critical breaking point, stage 3. This is the end game of ignoring that nerve compression. At this point, the pressure has been on for so long that it causes nerve damage that you can't undo. And the result of that is a permanent loss of mobility. We're talking partial or even permanent paralysis. This right here is the outcome we are fighting to avoid at all costs.
Okay, I know that was intense, but it's so important to understand what's really at stake so you can make a clear choice. Because now we get to pivot to hope. There is a proven way to get off that downward slide. There is a non-surgical choice that lets you heal the actual problem and get your life back without all the huge risks that come with surgery. And this slide just lays it out so perfectly. It really is a fork in the road. On one side, you've got the traditional route: invasive surgery, a long painful recovery, and a lot of risk. But look at the other path, the SRC route. It's not invasive, there's no downtime, and the whole focus is on true healing of the structure, not just masking symptoms or cutting out a problem. So what is the SRC route exactly? Well, it's a technology called fully automated spinal decompression. And the idea behind it is, honestly, it's brilliant. A computerized system very gently separates the specific vertebrae causing the issue. This creates a tiny bit of negative pressure, kind of like a gentle vacuum, inside the disc, which does 2 amazing things. It helps suck that bulging disc material back where it belongs, and it allows blood and nutrients to flood back in to start healing. This visualization shows you exactly what's going on. This is not some general all-over stretch. It is a precise, targeted force applied right where it needs to be. That gentle separation makes the space for that vacuum effect to work its magic, pulling the disc back into line and finally taking that awful pressure off the nerve. See? It's a solution that is actively fixing the mechanical problem right at the source. And you know what the best part is? This isn't some futuristic experimental idea. This is a proven global standard of care. So, it's time to talk about how you can actually take control of your own healing with a solution that is trusted, established, and available to you right now.
Over 122.
So what's with that number? Well, it means this isn't just some small standalone clinic. This technology is the backbone of a major American franchise with more than 122 locations all over the world. We're talking about the gold standard of non-surgical spinal care, proven to work across the globe, bringing world-class treatment right to your doorstep.
And getting started on this path could not be easier. It's really just 2 simple steps. First, you share your MRI report. This lets the experts see exactly what's going on with your spine. Second, you claim your free physical checkup. In that session, they'll check out your mobility and design a decompression plan that is 100% customized just for you. So after everything we've looked at, the real cause of the pain, the dangerous path of doing nothing, and the safe, non-surgical path to true healing, it all really comes down to this one question. Are you ready to stop just managing the pain and finally start healing the problem? Are you ready to choose a different path and reclaim the active, full life that you absolutely deserve?